Welcome back to Mostly True Psychiatry with Dr. Mellon. We're on our schizophrenia tour. We're still working on diagnoses for a few videos. So the criteria A, that's where all the meat is and the juice to the diagnosis. It's the big symptom criteria. Today we'll be going over the negative symptoms in schizophrenia. So again, negative symptoms is just a term used for schizophrenia. Probably a good way to look at it is that dichotomy, and just work on it for a second, for positive versus negative symptoms. They're categories of experiences, or the structure of experiences of the patients with schizophrenia. So positive symptoms of schizophrenia are additional things that they're experiencing beyond the norm. So those are your hallucinations, your delusions, where the negative symptoms are the absence or loss of those normal experiences. So it can be both emotional or behavior related. The DSM uses two categories of negative symptoms of schizophrenia. So they say avolition, which includes social amotivation and diminished motivation. And then they use diminished emotional expression, think flat affect. So for the avolition, kind of the words that they pop out as like buzzwords in the DSM are going to say active social avoidance, so that'd be avolition, anhedonia. They're emotionally withdrawn. And then I love this word, this kind of terming, passive or indifferent, apathetic. So in depression, we'll say that somebody has anhedonia when they don't do the things they'd normally be interested in. This is a much better way to look at it for schizophrenia. They're passive or indifferent. They think fundamentally different than you. You're putting your own emotions and thoughts on them to say that they're having anhedonia. And from my point of view, because if you actually interview and ask the patients if they're bored and stuff with schizophrenia when they're not doing anything, I mean, pretty much my experience is no, they're fine. They're content. They're not happy. They're not like bubbly people when they have these negative symptoms, but they're content. They're indifferent. They're passive. It's not the same thing as saying that they are like missing out on those things. It's anhedonia. So for the other half, diminished emotional expression. I love this. Poor report. If you have a hard time getting them to interact and like you, then sure, poor report. And motor retardation, physically moving less, that can happen. Lack of spontaneity, that kind of goes with it. Alogia, so reduction in speech output. We usually just say paucity of speech, but you can say alogia. It's one word, fewer letters, fewer syllables. Diminished emotional expression, so reduced emotional expression in all body language, the face, eye contact, speech, body movement, just reduced. That's why they're negative symptoms. We're going to skip the history on it. You guys don't care about that, and gals. So kind of some ways they're listed out sometimes. Sometimes self-neglect falls in here. So when we're making people go inpatient for psychiatry for schizophrenia, sometimes it's harm to self. It's self-neglect. So it's that patient who will stand on the side of the road, never bathe, never take care of themselves, just drink soda water and chips, and they have maggots growing on their feet, right? That's self-neglect. Impoverishment of thought, like, what are you thinking about? What are you doing? Nothing. No, really. What are you thinking about? What's your random obsession or hobbies? Nothing. It's impoverishment of thought. Flat affect is a buzzword. Do not use it unless they have schizophrenia. It's like sometimes when there's certain words that are specifically associated with the diagnosis, and they shouldn't be used outside of that diagnosis, because like if you say, hey, it's a thunderclap headache, worst headache of their life, it's like you better be putting on the plan that you're getting imaging of their head done right then, because otherwise it's probably malpractice. So like certain words are attached to certain disorders, symptoms, situations. So flat affect is severe reduction in emotional expression, no emotional range. It's schizophrenia. That's why you're using that. Otherwise, use the other terms like restricted affect or blunted, because you're not quite sure. And not everybody that has schizophrenia has flat affect for the negative symptoms. We talked about alogia, anhedonia. It's inability to experience pleasure in activities that normally provoke pleasure. I think that's actually taking a different person's point of view and pushing it onto the person with schizophrenia. Asociality, so apparent lack of interest in social interactions. Avolition, lack of motivation or initiation. for those normal activities of daily living. We talked about diminished emotional expression. So these are the negative symptoms. One kind of nice description of explanation I've also seen for negative psychotic symptoms would be underactivity, slowness, lack of conversation, lack of friends, avoidance of others, poor personal hygiene, lack of interest, and careless about personal appearance. So this is a good general description of what it means to have negative psychotic symptoms for somebody with schizophrenia. All right, I hope you found that was helpful. I'm going to go ahead and start up on the next video now.